This is 7 National News, and in our top story, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and Prime Minister of the UAE and ruler of Dubai, has affirmed the significance of assessing the government's readiness to adopt a culture of innovation, implementing proposed ideas to enhance government services and evaluating the process. His Highness Sheikh Mohammed made comments while chairing a brainstorming session with his team at his office in Emirates Towers, which was attended by Dubai's Crown Prince, His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum, the Deputy Ruler of Dubai, His Highness Sheikh Maktoum bin Mohammed bin Rashid Al Maktoum, and the Minister of Cabinet Affairs and Head of the Sheikh Mohammed Executive Office, Mohammed Abdullah Al Gargawi, among other officials. During the session, His Highness affirmed that the Smart Government project must continue evolving and keep pace with the latest significant and technological developments, adding that a smart government is not limited to smart mobile devices and it should explore wearable technology. His Highness also reviewed the preparations for Innovation Week that will be held next February, emphasizing its importance for the national innovation strategy that was launched by the UAE President His Highness Sheikh Khalifa bin Zayed Al Nahyan. Additionally, the ruler of Dubai reviewed the progress of the Arab Reading Challenge, which aims to encourage the next generation to read and targeting 1 million students to read 50 million books. His Highness Sheikh Mohammed also reviewed the work process and latest ideas proposed by the General Secretariat of the Ministry of Cabinet Affairs, the Prime Minister's Office, the Sheikh Mohammed bin Rashid Executive Office, and the Mohammed bin Rashid Global Initiatives. The Emirates Red Crescent has launched a new initiative to support and sponsor orphans in the UAE. The initiative is named Kahatain, which was announced by the director of the Abu Dhabi branch of Emirates Red Crescent, Mohammed Saeed Al Romaithi, and will be carried out in 2 phases to support 100 orphans or 20 sponsor families. The first phase will be carried out in the last quarter of 2015 with in-kind support such as furniture and home appliances, as well as financial support, including discounts on purchases and dental treatment. Workshops on painting and other arts will also be organized to help orphans. Meanwhile, the second phase will be carried out in the first quarter of 2016, where orphans will receive educational support. The Emirates Red Crescent currently sponsors 2,225 orphans and people with special needs in the UAE, 562 of whom are in Abu Dhabi alone. As a result of the expected rise in the number of stroke cases due to an aging population of the country, the UAE needs 10 more specialist stroke units. That's according to a senior official from the Dubai Health Authority. The thoughts of Dr. Sohail Al-Rukn, a stroke specialist from the DHA, came during the 2-day Middle East and North Africa conference today, which was attended by over 100 medical professionals from the region. Running for its 3rd edition, the conference will feature over 15 speakers from across the world, where discussions will be held about the best treatment and prevention methods to tackle the rising number of stroke cases. Identified as the 2nd highest cause of death worldwide, Dr. Sohail stated that over 7,000 people suffer from a stroke in the UAE per year. It was added that at present there is only 1 certified specialist stroke unit at the Rashid Hospital, with another expected at the Al Ain Hospital in the coming months. As a result of around 200 stroke cases every day, Dr. Sohail stated that they are working with the Ministry of Health to increase awareness of the disease, while also implementing plans to open 4 more units by next year.
There's 3 things that need to be done to increase public awareness about signs and symptoms of stroke. There's the FAST algorithm, which is drooping face, weakness in the arm, or speech problem, language. These are an acute sign of a stroke, and patients need to go immediately to the hospital to get the right treatment. Second thing, public awareness. Second thing is to establish a new stroke unit, and that will be done by pushing the MOH, pushing different authorities in the country to focus on stroke service, to build a stroke system in their hospital. And the third thing is to train our doctors, to train our nurses, to train our EMS services about stroke. And these are the main 3 components that DHA is working on. Dr. Sohail is trying his best to help other centers in the next 12 months to 24 months, we will have 4 stroke centers across UAE, and these are new stroke centers which will help the 7,000 stroke victims per year.
Why we have so many stroke patients in UAE? Because of the risk factors. A lot of people have high blood pressure, they have diabetes, which is undiagnosed and untreated. There was a study from UAE showed that 41% people who have hypertension, they don't take treatment, and those who take treatment, only 19% have blood pressure control. 28% people have diabetes, but they don't know that they have diabetes. So when they develop complication, that's when they realize that they have diabetes for so many years. So stroke is becoming a very important and major healthcare problem in UAE and the whole Middle East region. Smoking is a very important problem. About 26% people smoke.
In partnership with Boehringer Ingelheim, the DHA is currently working with over 20 hospitals in the region to develop their stroke units and offer the right treatment methods as part of their MENA Stroke Initiative. According to experts, quick response during emergencies, access to the right treatment and more trained neurointerventionists remains crucial for overcoming the challenges faced by the region.
This kind of awareness will help us to actually move forward. This is the first thing. The second thing is the process, because when the patient wants to take the medication, he should go through different processes inside the hospital during emergency to reach the medication. So what we're doing is to decrease this process and time consuming and have it like time is brain, so working on time to let the door to needle time, it means when the patient reaches the hospital till he takes the medication, be maximum 1 hour.
You need a specialized service, of course, as in many medical fields. It's people knowing what they do and having experience. One such thing is a stroke unit. That's a very effective infrastructure. The second thing is to give certain drugs to dissolve the clot. And in some cases, maybe 10% of the patients, then to add a third procedure that is, as we call it, mechanical thrombectomy, to just pull out the clot with a catheter.
The accelerated use of sustainable renewable energies, which also bring about a big reduction of pollution, remain essential solutions to promote climate change mitigation, according to senior officials. The comments come on the occasion of World Energy Day today, which was celebrated for the first time 3 years ago, after being called for by the World Energy Forum and where the UAE led a signing ceremony. On the occasion, Dr. Ahmed Belhoul, CEO of Masdar, stated that World Energy Day highlights the importance of society's choices relating to energy production and the environment, while also aiming to support the policies and solutions that increase energy efficiency across various sectors and countries. He added that at Masdar, they believe that sustainable development can only be achieved through collective international cooperation. He added that they are confident that focused mutual efforts of local, regional and global energy stakeholders will result in positive outcomes worldwide for the benefit of generations to come. The Roads and Transport Authority has added 80 new hybrid vehicles to its taxi fleet. The move comes to help promote Dubai towards a green economy and to help stop pollution from vehicle emissions. This also brings the total number of hybrid vehicles within the RTA's taxi fleet to 145, up from 65. Dr. Yusuf Al-Ali, the CEO of Dubai Taxi Corporation, stated that the initiative is important for development projects and to also nurture a safe, clean and attractive environment capable of raising the profile of Dubai. He added that with the deregulation of fuel prices policy adopted since August 2015, it is logical to phase out the existing fleet of fuel-powered taxis and replace them by hybrid vehicles, especially as the resultant fuel consumption efficiency rate has risen by 30% and carbon dioxide emissions rate has soared by 30%. A new UK visa service where staff will make house calls to UK visa applicants from the UAE will most likely be introduced in the Emirates before Christmas. According to a local daily, after successful trials in other countries as primarily a VIP service to deliver biometric enrollment services in the privacy of a home or office, the new service will be scaled up in the UAE to appeal to more of the general population. An official from the UK Visas and Immigration International was quoted in the report as saying that the new service will see visa application staff visit a private location upon request to take photographs and scan fingerprints as part of the biometric enrolment process. The process takes no longer than 10 minutes, helping applicants avoid applying in person at the visa application offices. The cost for the mobile biometric service will depend on a customer's location and the number of applicants. The report added that according to embassy officials, some of the new services include the ability of visa applicants to pay an additional fee to walk into application centres without an appointment, receive assistance with applying or paying online, or receive help with checking that their application form has been completed correctly. And finally, this evening, a special screening of films took place today as part of the third edition of the Sharjah International Children's Film Festival, featuring a series of 6 short animated films produced by the Save the Children program in Lebanon. A large number of students from various government schools across the UAE attended the special screening of 6 animated films made by Palestinian and Syrian refugees in Lebanon and disabled children in Sudan. While speaking about the films, the Lebanese animation trainer Dia Maleb stated that these films offer a glimpse of the daily lives of refugee children based in Lebanon and Sudan, and the content of the films deal with real-life issues of how these children are trying to rebuild their lives while forced to live in an alien environment. One of the films screened tells the story of a 13-year-old Syrian girl whose family was forced to flee Syria. It was about a family which lost everything they owned and are now amongst the million Syrian refugees trying to rebuild their lives in neighbouring Lebanon. The films screened as part of the festival's Make a Move, Make a Change category were made during a stop-motion animation workshop conducted by Dia Malaib, with the support and coordination of Save the Children, War Child Holland and the UNHCR, Children's Rights Institute and NABBA. The festival, running until the 23rd of this month, is dedicated to nurture and encourage homegrown talent and to promote children movie makers around the world.
The first thing is that we added 2 screenings of child-made films, and one of them will be screened today or tonight. And also I want to clarify that we have screenings for different age groups. It starts from up to 7, 8 to 10, 11 to 13, and 14 to 18. And you know that we add more workshops, more activities, and all of these things. We focused more on child-made films and children refugees, because they will get inspired, especially for the screening of child-made films by children refugees, seeing that they are living in this condition, but they made films.
Of course, we always emphasize on children and new media and new media art. So through this, we created the Sharjah International Children's Film Festival to help people and motivate them to develop their skills and their talents in filmmaking and in other things that are related to filmmaking, such as scenario writing, such as acting. So I think by this festival and showing them what have the kids done and what are the movies that are related to the children inspired from, we are inspiring them.
So I'm very excited. It's not because it's not about the movies, it's about making their voices reach, and this festival here and the press, of course, are the best window that we can show and make their voices go through, because the aim of the project is as I said, is not about producing a movie, it's about the story, because it's their story. So I teach them how to do the story, the movie, they do it, and we show it. So we're hoping our part is to make their voices reach to the stakeholders, to the people who's in charge in the authority, who have the authority to make new rules to help these children to change their lives for the better. The children are amazing, not good. They are amazing. They just need, especially refugee children who are living in the camps. They are just need a space. When you open a small window for them, you'll find a lot of creativity coming out from their hearts, because in the camps there is no spaces to play, there is no safe areas to be in, there is no minimum, like the minimum standards of life. So small windows like animation, you find they bring out their creativity in a very, like in an amazing way.